have more discussions coming your way. Now, it's about your tooth. A throbbing toothache can ruin your day, best believe it. But did you know it can also affect your mental well-being? Well, today is World Toothache Day. Believe it or not, a reminder that oral health goes beyond just bright smiles. It plays a crucial role in our overall health, our confidence, and even mental wellness. Poor oral hygiene has been linked to stress, sleep disorder, and also even chronic diseases like heart disease and diabetes. Yet, many people ignore tooth pain until it becomes unbearable.
So why do we delay dental care? And how does oral health impact our mental well-being? And what can we do to prevent these issues? Well, joining us now to provide expert insights is Dr. Dolapo Adekanmbi. She's a consultant in oral medicine and preventive dentistry department at Lagos University Teaching Hospital, LUTH. Dr. Dolapo, you're welcome to the program.
Thank you.
Thank you for joining us.
Jealous of dentists because you guys have it just, you know, I can just take care of my teeth right there and there. And so you guys always have these perfect teeth that I always find very, very interesting.
Oh, wow. Interested.
that was a covered compliment that your teeth look like. Well,
thank you.
Now, many people see toothache as just a temporary nuisance, but why is it important to take tooth pain very seriously first?
I will first tell you that the mouth is like the mirror to the body. The mouth is very important, and it's like a reflection of whatever is going on in your body. So you see that in the mouth. So it's important for you to take your mouth seriously, and then particularly your teeth seriously. And like you rightly said, a lot of people wait until things are bad till they come to the dentist, and it's not supposed to be so. Like you rightly said, you did a lot of research in that part. Knowing that the mouth plays a very crucial role, it's been linked to mental stress, a lot of systemic diseases like heart problems, you know, all over the body. So it's very important that you take your teeth seriously, your mouth seriously, and you don't wait till things get out of hand before you come to your dentist. And so today being World Toothache Day, we're going to talk about the importance of toothache and how it relates to your mental health and your mind as a whole.
To begin, how exactly does it?
Does it really affect your mind?
Yeah.
Mind is a long way. This is my teeth. My mind is here or here. You know what I mean?
Niggling pain, I would assume, it has a way of making you think.
Yeah, to draw your mind and make you go crazy.
You know what people don't understand about health? I love this definition about health by WHO in 1948. It defined health as a complete state of health, not just the absence of disease, but you know, you have to be socially, physically, and mentally healthy. So it's not just like a complete state of disease absentia, you have to be whole. So it's an holistic definition of health. And then that is important because your tooth affects you, or your teeth affect you. Now, how does this happen? If you have pain, you will not be functional. You cannot function properly. And that's because with pain, your mental state is affected. That's the first thing. You have pain, you're not comfortable, you're not productive at work. And also related to pain are other things that can happen in the mouth. What are the things that can cause pain? One is cavities. You have cavities, caries, we call that caries, which has to do with layman term holes in your teeth. That would act like a stagnant area for food to pack. And when food packs, apart from the pain you're having, you can also have malodor. That's halitosis in your mouth. And this also will affect your self-esteem.
Social, yeah.
Yeah, so this can lead to like social withdrawal, neglect, and then your mental health is affected. And with mental health affectation comes release of stress hormones. And you know what? That's like a, you know, it's like, I'm looking for the exact word to call it, because the body is like a network of organs and a network of things happening. So you have stress, releasing stress hormones, and this goes back to your mind, and you're chronically stressed.
You're just constantly that fight or flight position, like, you know.
And then more chemicals are released, chemical mediators like cytokines, and then it just goes on and on and on, and the whole circle escalates to just give a very huge thing in the body. So
Yeah,
people
like
can
a
go into depression.
mental health mess.
Mental health mess.
So I noticed something about when we speak about World Toothache Day, and we're actually just thinking about the tooth or the teeth. But when you came in this morning, you made reference to the mouth as a whole. So it's not just about the teeth.
No.
There's also other parts and organs even inside of the mouth that need care as well. Some people go without brushing their tongue. Let me surprise you. Some people don't even know that you have to brush the roof of your mouth. They don't know. So what must we know regarding this so that we don't find ourselves, one problem leading to the other, a cavity leading to halitosis, leading to social issues, leading to mental health issues? So what do we need to know starting from the most basic?
Thank you. So like you rightly said, the mouth is beyond the teeth. The teeth is just a part of the mouth, and then you start with your lips, and then you go into the mouth proper. So you have your teeth, and then you have your tongue, you have the palate, and then you have the soft palate guarding then you have the guards to the oropharynx. I won't go beyond that. So let's talk about the mouth proper now. So like you rightly said, you have your tongue, you have your teeth, and then what happens? People do not understand that they have to clean their tongue. So, you have dirt packing on the tongue. The tongue has a lot of brush-like or hair-like substances. We call that papillae. So it's very easy for that to trap dirt. And then when it traps that, the mouth generally is a lorry load of microorganisms. They are like normal commensals in the mouth, like they live there. So if you give them opportunity to fester or they could tend towards the negative side. So that's why you take care of your mouth, because there are a lot of organisms in the mouth. So if you have your tongue and you don't take care of your tongue properly, the tongue can act as traps for food substances and then for different organisms, and then this can build up to give you a furry tongue. And that is like one of the major causes of foul breath. So let's go to the teeth also. The teeth is held in the gum, and that is supported in the bone. So you have your gum, or we call it gingiva, surrounding the teeth. Beyond that, if you look deep into that, you'll see that there are some fibers that hold the teeth to the bone. And so we call that the periodontal ligaments. So what you see is, you look in your mouth, you see your teeth supported by the gum. And then beyond that, you could have microorganisms go inside between the teeth and the gum and cause havoc there. So they could destroy the periodontium, which is what holds your teeth to the bone. And then when that happens, you can have shaky teeth. So we call that mobile teeth. And then your teeth start falling off.
Wow.
So halitosis, really, when you think about it, what then causes it? Is it bad dental hygiene? Is it toothache or tooth decay? Or is there something more to it? I'm asking because I met somebody who was saying that they had issues with gingivitis or conjunctivitis, and so they had to continue to visit their doctor because that was what was causing a certain halitosis that they had. It wasn't that they had bad dental hygiene, it was just that this was what their condition was, and it seemed to be hereditary. Is this true, or is there more to it?
Well, it's not hereditary. Okay, so let's correct that. Although when we have it progress towards periodontitis, remember I mentioned the periodontium and the fibers. It could be familiar depending on the rate of progression. So we could have, let's keep it simple, we could have poor oral hygiene causing that, and we could have some familiar things like genetic, hereditary. So that's
genes. There we go. Yeah.
So that's talking about the advanced stage. Now let's just keep it simple. So let's start with the first question you asked about halitosis. Halitosis is very complex. It's beyond it's very complex. That means that you have things locally in the mouth that can cause halitosis, and then you have things from the body that can cause halitosis. So you're right.
Internally, from inside the body. is what
Yes,
you're
from the body, from the system.
What could it be, I wonder?
A lot of diseases. If you have lung abscesses or diseases, if you have kidney disease like diabetes mellitus, if you have liver disease.
So not everybody who suffers from halitosis actually has that resulting from
Bad dental hygiene or
oral
toothache or
hygiene.
tooth
Yes, but we
decay.
usually start with that first.
Okay.
You start from the simple before you go to the complex.
I wanted to know something about oral hygiene paraphernalia, what we use. Well, you talked about, well, we must have good hygiene, we must use our brushes and everything, but then when you talked about the gum and the teeth, you find out that you have spaces in between the gum and the teeth itself where food actually gets into and it's not accessible with your brush. Now, when I go to the dentist, they say, don't use toothpicks. They always tell me that, but that's often the only way to access these in-betweens. So what must we know about what we use in our mouth? Are toothpicks bad? Dental mouthwash, are they bad? Alcohol, no alcohol. What must we know about these bits and bobs that have to do with our oral hygiene?
Okay. So firstly, let me address that when you talked about the space between your teeth and the gum. Naturally, you're not supposed to have space between your teeth and the gum. So that is where your toothpick comes in because it destroys those things that are supposed to hold the teeth to the bone. So if you keep picking on, you keep destroying those fibers and then you create space and allow food to start packing. So that's why we tell people do not do that. It's better to floss.
Yeah, it's too late for me. There's too much space there, but go on.
It's never late.
It's never late.
The treatments that you can do, so that's where you see a periodontologist. So the treatments you can do, well, that is beyond the scope of what we're discussing today. Okay, so the next thing you talked about was?
Oral mouthwash, yes.
Okay,
alcohol, you debate between alcohol and no alcohol.
Okay. That's because you all know the side effects of alcohol. Alcohol has drying effect. So, and this will also like affect your salivary glands in the long run. We have some minor salivary glands in the mouth, and that can also dry out your mouth, which would definitely lead to halitosis. Because,
Itself?
Yes, itself. If you have dry mouth, saliva plays a crucial role in your mouth. You know, number one, it helps to cleanse the mouth. Naturally, you have saliva. I told you your mouth is a lorry load of microorganisms and you have saliva in the mouth. It naturally just helps you cleanse the mouth. And then it also has some substances that act as buffers. So when you take something that is acidic, which is what naturally leads to holes in your teeth, that's because if you take sugary substances, that's like carbohydrates. Let's start with that. So that is very good substance for bacteria in the mouth to act on. And then when they act on those sugary substances, they produce acid. And this acid will now wear down your teeth. It dissolves the teeth to create holes. That's where holes come from. Then naturally, if you take acidic substances too, this naturally can just wear down the teeth. So yes, so what saliva does is saliva has a lot of substances that can buffer these acids.
So are you saying there's no need to use mouthwash? Let your saliva just do its job?
So let saliva do its job. So that's what I believe, and that's what I tell people. But sometimes people are not satisfied. So you just tell people stay away from alcohol and mouth rinses. And then when we want to give mouth rinses to people, we do that when people have diseases like periodontal diseases. We actually advocate mouth rinses. That is after we've done our cleaning. So we can use that as an adjunct to whatever we do, and that's what we give chlorhexidine or hexidine mouth rinses. And we usually, because these are like drugs, they're used topically in the mouth, but we give time for people to use and then stop it.
You didn't finish answering the question regarding halitosis, and you were talking about the complexities when it comes to it. You said dental hygiene is still one that cannot be ruled out. Another is that there's some things that are happening internally. But what about the gum diseases? We're getting to that part. So
Yeah, yes, I was distracted with this question. So like I said, it's complex, and then you have some local factors, and then you have systemic factors. And then when you talk about local factors, you're talking about things in the mouth. So let's start. Poor oral hygiene. As the mouth that is dirty. That's the first thing you deal with halitosis. And then you go to other things like, are there ulcers or wounds in the mouth? Naturally, people have ulcers in the mouth. They can't clean the mouth properly because they have pain So this will act like stagnant areas for organisms to proliferate. Remember I said the mouth is a lorry load of microorganisms. So these organisms proliferate, and then they now act like they attract death, so the mouth smells. So other things that can happen is if people have appliances in their mouths, appliances can also act as stagnant areas. You have orthodontic appliances and you don't clean very well, like example of razors, or you have restorations and you do not clean around that very well, or you have restorations that are not properly made and they act as overhangs for calculus to or debts to form around, then this can act as areas that can act as stagnant areas for organisms and other food substances to stay and then cause halitosis. Now let's go to those gingivitis that you are talking about. So gingivitis, what happens in gingivitis is just when you hear vitis in medicine, it just means inflammation. Yes, that's when if you hear anything hitis like that, it just means inflammation. Gingivitis just means inflammation of the gum. So when it's the gum, it's still very okay because we can clean and take care of that. And so what we have is that when the gum is swollen, that kind of sort of creates, because it's inflammation of the gum, and there's things that happens with inflammation. There are 4 things that can happen with inflammation, and the first thing is swelling. The second thing is it can appear red. The third thing is pain, and the fourth thing is there could be temperature, like fever. Those are the signs of inflammation. And so, like I rightly said, like I earlier said, swelling. So when something swells up, it can create like a false pocket. It's not there, but because it's swollen, so it's possible for dirt to pack there, and then that can cause halitosis.
And what causes the swelling then? The gums to swell?
That's okay. So if like poor oral hygiene, so if your mouth is not properly taken care of, and you have dirt and bacteria accumulating around that area, it will irritate the gum. And when there's irritation of the gum, I don't want to go to the underlying chemical mechanism, but if it irritates the gum, it will swell. It will cause inflammation.
If you're sickle cell, can you be prone to swelling of the gum?
If you have sickle cell disease, yes, there are different things that can cause swelling of the gum with sickle cell disease.
Exactly, that's what I was getting to.
There are different things that can cause swelling, and that can come with different, a lot of people focus more on the systemic. You're looking more at the sickle cell, you neglect the mouth.
Yeah.
So and that's what happens generally with people with systemic disease. They focus more on the systemic, neglecting the mouth, which can come back to haunt the mouth.
I have curiosities regarding appliances inside of the mouth because I have installations, and I find that these installations are void of pain or feel, so you don't know when something is going wrong. So for those of us who actually have these installations or appliances, what special care must we give? You've told us perhaps maybe not to use alcohol mouth rinses, but what more must we know? Personally, I know I have to go back to the dentist, like perhaps maybe every 2 or 3 months.
Every 6 months.
Every 6 months. I do it 3 months,
Okay,
just to
that's
check the
good.
installation.
That's very
Because I'm
good.
not sure what's packing up in there, or if it's going to affect my gums. And I had that problem before, and it was horrible. And for someone whose the profession is communication, I can't afford to have that, go awry. So what must we know if you have appliances or installations, particularly when it comes to taking care of your teeth?
Yeah.
Or your mouth, generally.
Yeah, thank you. So when it comes to appliances in the mouth, you have to understand from the cleaning process first, there's a technique to toothbrushing. So we have a particular technique, which is the proper way to clean your teeth step by step. I wish I had a tooth model here with a toothbrush. Yeah, next time. I would have shown you how to properly clean your teeth and how to do it effectively. So once you get that technique, which is very, very important, then you can proceed to other things like the agents that were mentioned, accessories for cleaning your teeth like your flosses and all that. That's also very important, which can help you. Then the third thing is what you rightly said, and that's what you practice. You need to visit your dentist. Yeah, you need to visit it regularly.
Okay. You just said teeth model, and I'm certain that my producer's head is spinning in circles in there.
He's thinking of how
He's
to bring you
thinking of
back
how
again.
to bring you back to do a demonstration. Matthew, don't think about it.
Matthew, do.
Please do not. Good doctor, it's been amazing having you join us today and just giving us a bit of more about toothache. For those who are watching and pretty much is using local remedies.
Oh,
let us
yes.
sound the alarm on local remedies and just how, is it bad, is it good, is it important? You're the doctor, you're the authority here. Your take on local remedies.
Okay, like you rightly said, when it comes to local remedies, what are the local remedies? Fluoridated toothpaste. Your toothpaste should have fluoride. It's very important. Yeah, fluoride protects the teeth, so you want to use, a lot of people use About toothpaste, they use different things that do not have fluoride. So we advocate you use fluoride containing toothpaste. You change your toothbrushes every 3 months. You use medium bristle toothbrushes. For the hard bristle, you can wear off your teeth by using hard bristle toothbrushes, and you change your toothbrushes every 3 months, and you visit your dentist regularly.
What about chewing sticks?
And then,
And then those who rinse out their mouth with salt and water.
okay,
And
okay.
What else?
Okay.
Oh,
Okay.
alcohol.
I'll talk about that now. Then I want to briefly also talk about diet. So let me just talk about other things like
Chewing sticks?
chewing sticks. Okay, so what we do about chewing sticks, we don't condemn chewing sticks, right? A lot of people have used chewing sticks for years, and some studies have actually shown that there are some chemical benefits to using chewing sticks. So what we tell our people who use chewing sticks is also tell them to use toothpaste after they brush with chewing sticks. People are comfortable with the chewing stick, so we're not going to take that off because studies have shown that they are also beneficial. But we can also tell them to have toothpaste and toothbrush. And please, all those kind and all those things are very detrimental to the health of your teeth. Battery water, kind,
What?
all those.
You haven't heard
That's
it,
acid.
People,
There's one that,
people use
No.
battery water.
yes,
Honestly, I've read
yes, I've heard
different
of
things.
battery water.
Yes.
I've heard of, there's one that is a powder that they sell on the downfall buses.
Oh, touch and go.
Yeah, there it is.
Oh,
Please
yes.
stay away from those
Oh,
things.
please, no, doctor, no,
Please
let me do
stay
your
away.
job. Stay away because my installation started from a touch and go instance. Well, don't worry, just put it in there. What exactly is that substance? Oh, we're out of time, but what exactly is that substance? Because once you do use it, it's out.
Honestly, there are different chemicals that people have formulated to put together, different powders and chemicals. Just stay away from
Stay
them.
away from it. Stay away from it, people. Doctor, I want to say thank you once again for coming through and giving us this very interesting
Thank you,
insight
thank
into
you,
how
thank
how
you.
this affects not just our hygiene, but also our social well-being and also our mental well-being as well.
Right.
Thank you very much,
Thank
Dr.
you,
Adekanmbi.
doctor. Thank you.
Thank you.